Both Henry and Frank are fairly typical kids. They get really into their morning dance parties. They like to go outside and play and uproot all of the house plants. They're pretty standard kids, you know, they have a little bit of a bonus thing going on with the type 1, and they just sort of drag it along with them. Frank was initially diagnosed with type 1 when he was almost 10 months old.
He came into the hospital sick and was admitted to the intensive care unit. He spent a few days in the hospital while his disease was treated, and then his family learned about how to take care of a child with diabetes. Hasbro Children's Hospital is the only TrialNet site here in Rhode Island. TrialNet's been allowing us to identify patients who are at risk for diabetes before it develops. Their older son, Henry, enrolled in the TrialNet study and was found to have antibodies, or markers of disease. And over time, these markers increased in number.
TrialNet has given Henry the opportunity to very slowly progress into a treatment rather than having a sudden, sharp diagnosis and a shift to his personal life.
So have you been peeing more or drinking more?
Drinking more.
Yeah? Have you been waking up at night to pee at all? No? Okay, good.
So instead of having a big change all on one day, we've had many small changes. We slowly introduced him to doing his blood sugar checks. We've slowly introduced the idea that you will need to do insulin shots. You will eventually have type 1. And we have found that having that slower progression toward a condition that's going to be very present in his life long term has made it easier for him to adapt and sort of accept things without having any resistance to the shifts. For us, that's been the biggest benefit to the TrialNet program overall.
Henry remains symptom-free. He's not using insulin yet because his body's still making enough insulin. He is being monitored closely, and at some point in the near future, he will start using insulin, and we'll all be ready for that.
We sort of take an approach that it's very typical to have something you have to handle. And everybody has something, and you may not be able to see it, but they're handling it themselves. So that's sort of how we handle the difference that comes of having a chronic condition.
Frank and Henry's parents are incredible. They've continued to travel from New Hampshire down here to Rhode Island for their diabetes care because we've been taking care of them since Frank's diagnosis. And our diabetes team works very closely with them, and that continuity is great for the family. It allows us to take really nice care of the kids, especially as Henry is beginning his diabetes diagnosis.
Dr. Topper, throughout the years, has been an unbelievable support system, not just as a doctor, but as a person. The entire staff has always been very encouraging, and they've always just sort of come into the situation with a desire to help and a desire to give knowledge, and that's been one of the most amazing things. The more you can know about type 1, the better you can handle it on a day-to-day basis. They're just wonderful. We're big fans.